there are some changes that a woman starts experiencing from as early as 30 years old. Okay? Some changes in your period, it can become irregular, it can come far apart or close together, it can become heavier or lighter, it can last longer or shorter, it can become more painful or less painful. So your period can start changing. And then you can also start experiencing some symptoms like anxiety or depression. Okay, as women, we have decided we are no longer suffering in silence. If you have any symptom of perimenopause and menopause that you feel is affecting your quality of life, I want you to know that you are not alone. And there's a huge community of women waiting to welcome you and walk with you through this journey. So please reach out to a menopause care provider for help.
Hello, Persbudia TV family. How you are doing? Another week is here, and as we promised you, this year we are all about empowering. We are all about information that you need. You tell us, because you're the one who asks us what you want to hear. And the last episode I did with Dr. Esther, which was about psychology issues, home issues, you also requested for a gynecologist because you said, Paris, you are a woman, and we want you to bring us a doctor who will talk about women's health. Wait no more. Today, I have a dear doctor here with me, a young, beautiful doctor. She's not only beautiful, she's got brain too. So don't go nowhere. Today we're going to be discussing about women's health, and more importantly, we are starting the topic today with menopause. I like to say this because I'm going through it. Menopause is an evil older sister of people going through adolescence. I swear, that's how I feel. But because I'm not an expert in this area, you know, I don't know nothing about women's health when it comes to that. I'm all about skin. But today we will not be talking about skin. We're going to be talking about menopause. And we hope that you love this topic so much so that we can do 12 series. My goal is to do 12 series with Dr. Amanda, and maybe even more, talking everything women's health. So all your questions, please start writing them down now on our TikTok page, Instagram, wherever, so that Dr. Amanda can prepare to answer your question on the next series that we're going to do. But I don't want to keep you waiting. Let me introduce my beautiful young doctor, Kenya.
Wow. Thank you so much for the wonderful introduction and the compliment. I'm Dr. Amanda Kenya, an obstetrician and gynecologist. That means I'm a women's health specialist, sexual and reproductive health specialist. And I'm particularly passionate about hormone health throughout all the stages of a girl and woman's life, from the beginning to the end. And I'm so glad to be here to talk about one of my favorite topics, which is perimenopause and menopause. So thank you for having me.
We are so humbled, and thank you for, honestly, we called and you answered.
Yeah.
You normally don't get Dr. Frontier like that because we understand you're busy. You have a busy life. So for you to even take this time just to come here and educate women on this matter, I really appreciate you for that. And without delays, mine is, first you tell us, there's this myth about perimenopause and menopause, who goes through it, what age does it start, when does it stop? First of all, what is menopause? What is perimenopause?
Usually, a woman will experience menopause at around the same age as her mom or elder sisters, and usually it will be to around the same degree in terms of severity. So basically, menopause is when your ovaries finish doing their job, like they're wrapping it up, they have retired. Okay?
First
retirement.
Yes.
It usually occurs at around the age of 50, 51, 52. But that number is based on studies that were done on, around the world, not necessarily in Africa.
Yes.
And we have found in Africa that age might be a bit lower, around 48, 49. So that's the normal age of menopause. And menopause is when you have not had your period for 12 months. That's 1 year. Okay. So even if you miss your period for 10 months and then it comes, that's still not menopause.
Oh, Jesus.
I know. So 12 months is when we say you have reached menopause. But now, before that, up to 20 years before that, there are some changes that a woman starts experiencing from as early as 30 years old. Okay? Some changes in your period, it can become irregular, it can come far apart or close together, it can become heavier or lighter, it can last longer or shorter, it can become more painful or less painful. So your period can start changing. And then you can also start experiencing some symptoms like anxiety or depression. That's now the mental health aspect. Some brain fog, which means you're forgetting things.
Brain fog, I'm going through that.
You're not feeling as sharp as you used to be.
Yeah.
You're struggling to do tasks that you used to find so easy. You can become irritable. And then there are also other symptoms like hot flashes during the day, night sweat, drenching sweats at night. You can also experience some changes in your sexual health, like vaginal dryness, low libido and sex drive. You can even find difficulty in becoming aroused. And then there's so many symptoms because every single cell in the body responds to estrogen, whether it's in the digestive tract and now suddenly you can't have wheat or you can't have milk anymore, whether it's in your joints and now you have joint pains, your skin becomes dry, your eyes become dry. All this is due to a reduction in estrogen, which is one of the hormones that are produced by your ovaries. And your ovaries have retired.
Yes.
So you're going to start experiencing all these symptoms all the way up until menopause.
Yes.
After which they'll still continue for some time, but eventually they go away on their own.
For real?
Yeah. But
after how long?
So you can have the symptoms for up to 15 years.
Oh, Dr. Amanda, you're killing me here.
Everyone is different, but we can't put a number on it.
Yeah.
I have an 75-year-old patient who is still having hot flashes came to me with that issue because she had been told that once she reaches menopause, after a few years, all these symptoms will go away or they'll get less and less and she'll be able to live a normal life. But she has found that that's not the case for her. And now she's reaching out for help. And that's why I'm here today.
Yes.
To educate us what is normal, what is not normal, and what can be done.
Like, I'm really shocked. I'll be honest with you. The day my period started, disappearing, I'm gone. It's like playing hide and seek with your period.
Yeah.
They disappeared for like 3 months and I was clapping. Yeah, I'm done with that. Yeah. You know what I mean? And then you're wearing white.
Gosh.
And you've gone out.
Yeah.
And you're boom. They're here again.
Oh my gosh. Yeah.
What are we supposed to do during this time of confusion? And how do we prepare our daughters and even us who are going through it? Yeah. Because you say that it can start as early as early 30s to late 30s, right? Yeah. You can be on perimenopause. So what are the telltale signs that I should be looking out for to know, wow, this is not normal? Maybe I need to go see Dr. Amanda and see what to do about this.
So basically, if you're experiencing symptoms that you think are due to perimenopause, of which there are over 100, right? I've already mentioned some. If you're experiencing any of those, but maybe I should add more. Palpitations.
I thought I was having heart attack.
Yes. A lot of women think they're having heart conditions. They go see a cardiologist. They check everything is okay, but they're still having palpitations. That's one of the symptoms of perimenopause. Okay. A change in the digestion, so either constipation or diarrhea or hyperacidity, just because your stomach and intestines also respond to estrogen. You can get a new asthma in your 40s, perimenopause. You can get eczema, psoriasis, hair thinning.
Oh my
hair
God!
loss, itchy ears.
Is that why I'm getting looking like eczema on my leg?
Most likely, if you've never experienced that.
No, never.
Yeah, it is.
Well, let me ask you also, what caused this? Let me tell you, I'm a very good candidate for this interview. Yeah. You wake up in the morning, your body normally, when you wake up in the morning, what do you want to do? You want to go to the bathroom, empty your bladder, you want to pee.
Yeah.
Then you go sit down, pee is not coming. Then you have this pain that is around lower back and everything. And then after a
short while,
the pain just disappears as if it was never there, and you're normal again.
Yeah.
But if you try to explain to your husband that pain wanted to kill you, you felt you are even sweating.
Yeah.
What is that and what causes? I swear I've gone through that. I thought I was dying.
Yeah.
And then all of a sudden I read and it said that, it's one of the, side effect of menopause.
Yeah. What you've mentioned,
Yeah.
coupled with waking up at night a lot
I'm
to
not
pee.
sleeping at all.
Yeah. As well as what we call urge incontinence, where if you feel like peeing, you have to get to the bathroom immediately or you leak urine.
Oh.
Or you're leaking urine when you cough or when you stand up or when you do certain things.
Oh.
So basically the entire urinary tract and the bladder need estrogen. Okay? And when they don't have estrogen, then we get these symptoms that you're talking about. Becomes they start spasming, like the bladder is spasming, causing you that kind of pain, being overactive and irritated, making you keep waking up to go and pee, even when you don't have that much pee in your system, getting recurrent UTIs. That's all part of perimenopause. And the treatment for that specifically, it's called the genitourinary syndrome of menopause. A bit of a hard name, but it just means anything to do with your genitalia and your urinary system. We apply local estrogen down there. Twice a week only. So I usually start that in all my patients from around the age of 40, whether or not you have any of these symptoms, because it's inevitable. If you live long enough, your genitalia and your urinary tract are going to start experiencing changes from the loss of estrogen. So we start early to prevent it.
But you know what is so funny? Now you're saying that and I'm like, oh my God. When that pain became, I remember 2 years ago when I lost my dad, after his funeral, I had that lower back serious pain that I could not explain. But I thought it's the stress of mourning and I wasn't drinking enough water and everything. So my husband took me to a local clinic and we went there to a local doctor, just a general doctor. And all they said that, you have UTI. But when I went to Canada and I went to see my doctor, they told me, no, the UTI was caused because now what you just explained here, Paris, you're going through perimenopause. And all these things you are feeling, all these occurring UTI that is because, but you see, my general doctor wasn't able to tell me that
they got it right to the UTI, but they didn't know why you keep having these UTIs.
So is this why we need to understand that doctor is not just a doctor? You don't go to a general doctor when you're a woman and you think you're experiencing issues that you should see.
It's not only when you're a woman. I think as Kenyans, we have really gotten used to going to what we call casualty or accident and emergency for any problem we have. But I'm a strong believer that you should go to see the doctor who specializes in the issue you have, unless it's like a flu or a mild headache. If you have a women's health issue, go to a gyna. If you have had a cough for 2 weeks, go to a chest specialist. If you have had constipation or diarrhea for more than 2 weeks, go to someone who specializes in the stomach and intestines. Going to accident and emergency means you're seeing someone who might not be well versed with what's going on. You might get substandard care or care that is not completely comprehensive. You'll be treated for the UTI, but you'll keep getting UTIs because they might not know what is truly the root cause.
Very true.
Yeah.
Now let's go to night sweat or what we call hot flashes. These days, I am honestly surviving on maybe 2-3 hours sleep, and I am sleeping in the morning. I see when it start cooling down, allowed 5 in the morning, that's when I want to sleep and I have to go to work. Now waking me up in the morning, I just want to sleep because at that time I'm not sweating too much. I could be here talking to you right now and I just break out on sweat. What can we do about this and what causes these hot flashes as we go through this?
Hot flashes, like every other symptom during perimenopause, is caused by a reduction in the estrogen level, in the body. But now for this specific one, it's in the brain. Okay. So yes, this is actually a brain issue.
For real?
Yeah. So there's a part of our brain called the hypothalamus. The hypothalamus is the thermometer, is the temperature regulator of our body, and it's in the brain. So during perimenopause and menopause, this hypothalamus is lacking estrogen, and so it starts to malfunction. Okay, it becomes very, very sensitive. So once in a while, during the day or night, when there's a slight change in the body's temperature, the hypothalamus reads as if you are in a very hot area. Okay? And it makes you feel the heat and it makes you sweat to cool you down. That's why people are sweating a lot. Yeah. And then as soon as you finish sweating, the hypothalamus has finished its job, and then you feel cold. You start having chills in the middle of the night. So you see a lady saying, I don't know if I should sleep with a duvet or a thin sheet or naked or with a t-shirt.
I do all of that within one night.
Yeah. And then during the day, we advise you to wear layers. So like a vest, a top, a sweater, a jacket. So if you need to remove, you start removing one by one.
Yeah.
It can be quite difficult. So in terms of treatment and managing, I believe in holistic menopause care.
Okay.
So we have to start with the foundation, which is a diet, nutrition changes, and appropriate exercise. And then we can add some supplements that are specifically geared towards acting like estrogen in the body. But the number one most effective treatment for moderate to severe hot flashes and night sweats is hormone therapy, which we'll talk about shortly.
Yeah, because talk about that is one of the questions. In fact, I had written down the question, but you're going so well. I'm not even having to look at the question because you've tackled most of them as we are going. Yeah, HRT is one of the questions I've been asked here. Some women choose hormone replacement. Why? What are the side effects? Who qualify for this? Does it interfere with, for example, I know a lot of women who are going through menopause, but they also take blood pressure medication for whatever reason, or they're going their diabetes for whatever reason. Doesn't interfere with this medication? Who is the candidate? Please talk to us about this.
There's so much to be said. First of all, we are no longer calling it HRT. That's hormone replacement therapy.
Yes.
We're now calling it MHT, which is menopause hormone therapy. And here's the difference. If you are having perimenopause and menopause symptoms, and I want to give you hormones, I am only giving you a little bit, a very low dose, to make your symptoms go away. But if you are a much younger lady or girl who happens to have ovarian failure and she doesn't have hormones, I'm going to give her enough hormones for her to hormonally look like someone her age. That one is replacement. I'm replacing every single level of hormone that she's lacking so that she looks like someone her age.
I got you.
For menopause, I'm just giving you a tiny dose to relieve your symptoms. And that's why we see as we're treating you, we're monitoring your symptoms. We're not monitoring even the levels of the hormones. We're monitoring your symptoms. So that's the difference. Now, is hormone therapy safe? Right? The big question.
Yes.
Number one, yes. Okay. For the vast majority of women, hormone therapy is safe. But let me tell you why for the longest time, we thought it was not safe.
Yes.
Okay.
Yes.
20 years ago, in 2002, they did this big study called the Women's Health Initiative. And this was the biggest study of its kind to this day. And they recruited women between the ages of 50 and 70. And some they gave hormones and some they didn't.
Okay.
And then they followed them up for many years. And after a short while, they stopped the study and they even before calculating the data, they stopped the study and it was on all the newspapers and all the news channels. They said hormone therapy causes breast cancer.
Yes, that's what I heard. And that's why I'm afraid of it. I've not taken it.
Right. Immediately, doctors stopped prescribing it. Women stopped taking their hormones because back then it was very, very common. By the time you reach 40, 45, you start hormones. It was known as the thing to do. Yeah. And so they stopped. And for the next 20 years until recently, even us as gynaes in school were barely taught about it because it's a lost art. Right? Because it causes breast cancer.
So you're fixing one problem by causing another.
Now, we have realized we can look at studies more deeply and examine them more and not take them at face value and see, did this study really show what they're saying? And the answer is no. Okay? No. And in fact, even the people who did the study, the principal investigator came out and said, actually, my study did not show that hormone therapy causes breast cancer. Okay. And there were some flaws in that study. They were doing this study on women who are a bit older than the women who we start giving hormones to. So already that's a risk.
Yes.
Number two, they were using synthetic hormones, which is not the hormones we use these days.
Okay. What's the difference, Dr. Amanda? You know, for somebody who is listening in the village, synthetic hormone.
Yeah, I'll explain to you that. And number three, basically, just the analysis of the study was poorly done. Okay. So nowadays, we use hormones which are called bioidentical hormones. This means our technology has improved and now we're able to make hormones which are identical to the one your ovaries are producing. Okay?
Yes.
So if you're currently producing estrogen, is that estrogen causing you to have breast cancer? No. So why would we expect then a bioidentical estrogen to have any harm? Right?
True.
So we're using completely different hormones. We're no longer using what they used to use. Those were man-made things that they, really tried to put together in the lab. They were close to what our bodies are producing, but not quite. They had a bit of differences. And those differences increased the risk of breast cancer and of getting blood clots. Okay?
Yeah.
So these days we're giving different medications.
Okay.
Number two, they used to give hormones in form of pills. Okay. And what happens when you take a hormone through a pill form, that's estrogen specifically, it passes through the liver and the liver does something to it. And then it increases your risk of getting blood clots, either in the legs or in the lungs.
Okay.
So we rarely give pills anymore unless there's a very special situation.
Okay.
Now we're giving hormones through the skin.
How do you do
that? As a cream. Or as a patch. Which you change every 3 or 4 days.
Okay.
So this makes the hormones even safer.
Cream. So where are you applying this cream?
Apply on your forearm or on your thighs.
And it affects.
And it works.
For real?
Yeah.
Are you telling me, Dr. Amanda, before I leave here, I just need to live with the cream and I'll be...
You can.
I won't be experiencing hot flashes and I'll be able to sleep again.
You will.
It's that easy.
It's that easy. And if we're thinking about costs, unfortunately,
I was going to go there.
Unfortunately, a lot of our local insurances are not covering.
Yes.
A few are refunding patients when they buy the hormones.
Okay.
And also international insurances are refunding.
Okay.
But cost-wise, I would say between 7 to 10K per month.
7 to 10K per month. So, wow. So this is rich people.
Because unfortunately, that's what it looks like.
For the women we are talking to, because we know we are talking for people who live in Nairobi and who live in the village somewhere who do not have that kind of money, or we are talking to middle life, because they all suffer. Perimenopause doesn't choose where you come from or your pocket.
That's true.
So then how will I be able to afford 10,000 a month?
That's the thing. That's why we're trying to advocate for these drugs to be more affordable and for our government to provide them. Menopause has not been something that's talked about enough or that's focused on enough. It's always maternity care or, young adolescent care.
True.
And once a woman has finished giving birth, that's it. It's a wrap. You can go home. There's no insurance cover for that. But now we're finding once we speak out, we bring our voices together, talk to our insurances. Some of my patients were saying that at their workplace, they have a cover, right? But many of them have maternity cover, and yet they have already finished that side of their life.
True.
So they talked to HR and got the insurance to convert this maternity cover to menopause so that they can be covered for their hormones and their treatments. So we need to bring our voices together and speak out. But in the meantime, not long ago, we now have a menopause clinic at Kenyatta National Hospital.
Okay.
So that's a place someone can start if they are not able to seek private care just to get the help they need.
Yes. And honestly, how long will it take if, for example, I, Paris Budia, today, I'm almost a 51-year-old woman and I want to start this.
First of all, I won't believe that until I see your ID. 51.
Somebody give me my ID. It's in my bag. I'm 51 years this May, and I'm already, I can honestly say I'm on fully grown perimenopause. Not yet. You said so
Not
long
yet
as you're
menopause,
receiving
yeah.
your period, you're still not on menopause. But mine is slapping me hard.
Yeah.
Hard. I'm normally a happy girl.
Yeah.
And literally my husband is saying I'm not a very happy girl.
Right.
You know?
He's
There's mood
walking on
swings.
eggshells.
There is like I said, I don't sleep well. So obviously, you know, if you haven't, you are sleep deprived. In the morning, you're not in
The
good
rest of your
mood.
day is messed up.
Right?
Even your performance at work.
I
your
actually own a
relationships.
clinic in Lavington Mall. I treat skin, and lately I'm fighting. I don't know. I'm not passionate about it.
Right.
I'm not. Now I'm employing. I'm actually looking for a dermatologist to work with me because now I'm not really myself.
Yeah,
you know.
a lot of women around this age group quit their jobs, quit school, quit their PhDs, and kind of give up because they don't know what else to do. They're not feeling like themselves. If you have the symptoms, and these symptoms, you can just check on the internet. What are the symptoms of menopause?
Yes.
If you feel like you have them, and they're affecting your quality of life, because you know some people have a hot flash here and there, and they're fine.
Yes.
If it's affecting your quality of life, please see a menopause care provider. That's the best place to start, so that we can figure out if we're starting hormones or if we're going to try and do it naturally or if we're going to try supplements. We'll figure it out based on your preferences and, you know, your own specific past medical history. Because like I said, most people are good candidates for hormones, but there will be a few people who are not. Yeah. So we'll discuss with you. It's personalized. What your friend is doing might not be what's best for you. So it's best for each person to get their own consultation and see.
So you mean I cannot copy what her doctor told her?
No, you can't.
What would be the one reason why one will not be a good candidate for the therapy?
If you currently have breast cancer, for example, there are some breast cancers that grow bigger when they are given estrogen. Okay.
Right.
That's one of the only ones, by the way. Like you mentioned,
Blood pressure, if I'm taking blood pressure medication. Yeah.
If your blood pressure is well controlled, you can still have hormones. If you have diabetes, you can still have hormones. Okay.
Yeah.
If you have hyper or hypothyroidism and it's well controlled, you can still have hormones.
Now that you've told us that, you know, anybody can be a candidate for the therapy, but it depends with not one fit all. So I cannot be listening to my friend who tells me my doctor said I should take this and I go and start taking it. What are the few things that we can start doing at home where diet is concerned? You see there's exercise.
Yeah.
See, for example, I do exercise. I do try to eat well, but maybe I'm not eating the right diet. I do take vitamins, but maybe the vitamins I'm taking, they are not really helping me when it comes to menopause or perimenopause. Kindly be kind enough to tell us at least one vitamin we can buy out there and use, the kind of diet you would encourage us to go to use before we can come see you. Yeah.
Okay, so I'll actually do you a favor and give you 3 that I advise all my patients to be on. Okay. Unless there's something special happening.
Yes.
Vitamin D.
Vitamin D.
So many of us are low in vitamin D. I myself am on a vitamin D supplement.
True.
You can have your levels checked, or you can just start a vitamin D supplement. Around 2,500 to 3,000 units per day. Okay. You know, these days we're indoors a lot, so we're not getting enough sun for our skin to make vitamin D. And also we have melanin. So unlike Caucasians, our skin is not able to make vitamin D as efficiently. So unless you're going to decide every day at 10 a.m. I'm going to go out in the sun for 15 minutes and bask in the sun, if you're not able to do that, start a vitamin D supplement. Vitamin D is not just a vitamin, it's actually a pro-hormone. So it's used to make most of the hormones. And when we are during this period when we need our hormones to be, you know, boosted, it's good to have normal vitamin D levels.
Very true.
Number 2 is magnesium.
Okay. I take that
magnesium,
at night.
Great. Does it help you sleep? Does it help you relax?
It helped me relax, but sleep not.
Yeah.
Yes.
Insomnia, lack of sleep, whether it's lack of falling asleep or difficulty staying asleep, is very common in perimenopause. It can actually be so debilitating. So if you feel like magnesium is not helping, we can talk on the side because there are things that can help you.
All right.
But magnesium is really good for women during perimenopause because it's also used to make hormones, and it's also used for energy. Our body uses magnesium a lot, so basically we need it. And if you're going to buy a magnesium supplement, make sure it says magnesium glycinate or magnesium bisglycinate. Okay, that's the specific one we want. And you want 400 milligrams at night. Okay. Then omega-3. Unless your diet is very, very rich in omega-3 with a lot of fish and beans and all that. If you're not able to get that, I would advise you to be on an omega-3 supplement, whether you're taking cod liver oil or if it's just plain omega-3 in a capsule form, 1,000 milligrams. Once a day is enough. Okay. Very important.
Oh, I don't take that because I hated it. My mom used to give us when we were little by force. I hated the taste of it.
Moms know best. If you really don't like the taste, you can take the capsules. You can take the capsules. Yeah.
Okay.
So those are the 3 supplements I would say.
Vitamin D,
start with them.
And magnesium.
Yeah.
Awesome.
Okay. And then in terms of nutrition, you can be eating a balanced diet, but you might not be getting enough of what you really, really need during this time. So like we say, perimenopause and menopause, it can be a quite difficult time in your life, but it can also be a wake-up call for you to change your diet and your exercise or your physical activity regimen in order to help you live longer and live a quality life. So during this time, our foods need to be whole foods, okay? So basically, whole means it needs to resemble the way it looked when it came out of the ground or when it came from the animal. Okay. So processed food like bacon, does bacon look like a pig?
No.
Does it even look like meat?
No.
Does flour look like maize?
No.
So we want
chapati daktari. We live in Kenya.
It's a wrap. No, it's over.
Chapati and ugali and the way I love this are my food.
I'm so sorry. It's really over.
You want me to stop eating chapati?
At least have the brown chapati if you must. Okay.
How many times a week am I allowed?
That's a treat.
I eat them like 4 times a week.
And you're telling me about your hot flashes and all that, right? We want whole foods, whole potatoes, then domas and
so
guashes.
Potato is good, guashe I do, doma
Yeah, that's okay. But let it be whole, right? We want to avoid anything that has been processed, anything that has gone through a change, a very rigorous change from its original. Yeah, we want to reduce. Not stopping completely, because we also want to enjoy our lives and the things we love, but we want to reduce.
Bread? I cannot even eat bread anymore. I love croissant.
Oh gosh. Does a croissant look like anything that came from the earth?
I'm asking for me and so many people that I know.
Extra sugar, I know.
Yeah.
I know how hard it is, but these are all things we need to just reduce.
So for breakfast, what should we be eating, to be honest?
Eat the meat that was bakished from last night.
Leftovers.
Yeah. Eat meat.
So my husband is doing something right with his life because he don't like to eat breakfast, he eat food.
Mm-hmm. What do you normally have for breakfast?
I'll have
What did you have today?
Oh, today I had 2 eggs and 2 pieces of toast.
That's not bad.
And coffee.
That's not bad at all.
But I did have bread.
Coffee is a stimulant. Coffee, tea, hot chocolate.
Yeah.
They can actually trigger the hot flashes, the night sweats, the insomnia, as well as alcohol and smoking. So if we're doing
what life are we going to have? Because we work so hard, Dr. Amanda, so that when we now can have a little bit kashing-ching, we're able to enjoy fine things like a glass of wine. We're able to enjoy fine things like a good, what do you call it? I like my French press in the morning, coffee.
Ooh, nice.
Now, when you take that away...
We're not taking it away. How does it make you feel? Have you ever journaled about your symptoms? So I usually advise my patients, first thing when you wake up, just have a little notebook next to you.
Okay.
Quickly, just jot down how your sleep was. Sleep great or sleep terrible or woke up 5 times to pee.
Okay.
Again, leave it there next to your bed. At night, when you're just before bed, just comment 3 hot flashes today. I had a presentation, didn't do well.
Okay.
And then take note. You'll notice when you take coffee, you have a terrible night. When you have a croissant, you feel terrible. You'll notice how the things you're doing daily in your life is affecting your health. And once you notice that, stopping will not be hard, because you'll be saying, this is not me depriving myself. This is me serving my body. Now I've reached this point in life where my body needs something different. Right?
Wow. So asking for me and millions of women that will be listening to this, we hope in future now. My God, this is hard. Because, no, seriously.
Yeah.
Because Dr. Amanda, you've just taken all the good things in life away. Because if I'm not going to drink coffee in the morning, then what am I supposed to drink? Because tea also have caffeine.
Yeah.
Now, how am I going to, honestly, for women who are very busy like I am, how am I going to face my day without my cup of joe that I'm used to? And now I need to also have energy.
Yeah. Now you find, if you're eating healthy foods that have a high protein content, like 30 grams of protein, because you want your protein to be a bit higher now, you'll have energy. If that's not doing enough and you're doing enough exercise to give you energy, then we can give you a few supplements to give you a boost of energy, like vitamin B6 is great for energy without stimulating hot flashes. There's a supplement called rhodiola that's also very good for energy. So there are things out here that can help us. Even the herbs like moringa, without causing problems. Yeah. Or you can have decaf. What do you like?
I used to have decaf when I was pregnant with my two children, because obviously your kind of will tell you, no more coffee. I've always loved coffee. Yeah. So I used to have decaf. But to me, decaf is like, it's like eating a chocolate that doesn't have sugar. No.
Right.
It's not the same. It's not slapping the same, right?
Doesn't slap. With time, you get used to it. You know, sugar is a drug. It's addictive.
True.
At whatever age you are, you need to be weaning yourself off of sugar. Don't wait for perimenopause or menopause.
No, I have no problem weaning myself off sugar. It's the coffee and the fine wine now and again when you're out with your girlfriend or you're having a date night with your husband.
Once in a while.
I thought they say wine, a glass of wine every day is good.
No, we don't say that anymore. That's teaching. Yes. Stop spreading misinformation on your show. That teaching is long gone. So there is no amount of alcohol
that is good for you.
Safe.
I said that so that you can make sure that our viewers are hearing that.
Alcohol is toxic to your brain, to your heart, to every organ in your body. Alcohol is actually responsible for more cancers than smoking. So we really, I mean, if you must, you must.
So
no one
quit
can judge
alcohol,
you.
literally altogether.
If you can stop, just stop. Because it's genuine. It's not helping you in any way.
Okay.
Yeah.
Now, last.
I didn't talk about physical activity.
Yes.
You find a lot of women in this age group, we're doing a lot of walking and jogging and cardio. What we really need to focus on during this time is strength training. Okay. So if you're able to get some dumbbells, if you don't want to go to a gym and start lifting weights, if you're feeling a bit scared or
you're
shy,
busy,
or you're busy, just get some dumbbells from Jumia, and just go on YouTube and search menopause strength training or menopause workout, and just see the simple exercise videos that you can follow to start building muscles, which will protect our bones from the weakening that happens, with age, and just help us live a longer, more quality life.
At least that I'm doing. That I started doing because I started having a little bit of pain on my knees, and my doctor told me to do. And I started doing strength training a little bit at home. I don't go to gym, but I do it at home, and I find it helps. Dr. Amanda, you don't understand. You've really been an eye opener on so many. Even for me, on a personal level, you've really helped me. Now, before we leave, looking at that camera, what is the one thing that you would want to tell the person watching us today?
Hi, lady, watching this at home. Let me give you a word of advice. This is 2025. We are no longer suffering. Okay, as women, we have decided we are no longer suffering in silence. If you have any symptom of perimenopause and menopause that you feel is affecting your quality of life, I want you to know that you are not alone. And there's a huge community of women waiting to welcome you and walk with you through this journey. So please reach out to a menopause care provider for help. You don't have to have 20 hot flashes in a day. You don't have to suffer in your marriage with a low sex drive. You don't have to have your periods every week. You don't have to feel depressed and anxious. You don't have to have low performance at work. Anything you're feeling you're going through, please seek care. I promise you there's an answer. And then please talk to someone you know, someone you love. Let's start having these conversations at home. We can't expect the world to talk about things when we don't even talk about them amongst ourselves, in our families, in our chamas, at work. Talk to people, and you'll find there's so many other women just like you who are willing to walk the journey with you. So, as a last word, there's help out there. All you have to do is put up your hand and it will come to you. All the best.
Oh my God, that is so good. Now, Dr. Amanda, please tell these beautiful people that are watching us today where they can find you, because I'm very sure this information is not enough. Even if it's enough, you told us that this journey is a personalized journey.
Yeah.
So they might have listened to you, but they want to come see you so you can walk this journey with them.
Right.
Where would they find you? How can they reach you even to book appointments?
Right. So what I would say, reach out on 0769 160 367 or email admin@drkenya.com to reach out so that we can decide where we're going to meet and when. That's the best way.
Awesome.
Yeah.
Thank you very much. I'm humbled, and especially for a woman who is going through perimenopause right now. I am sure I'm going to be one of your clients. One way or another, I'll be one of your patients, and we can walk this journey together.
Consultation.
Yes. And I'm humbled that we're going to educate women together about this, you know, because honestly, it's a monster that is affecting a lot of women. And like I said, they're suffering in silence. And for Paris Boudia TV community, thank you for watching. Thank you for subscribing. Thank you for following us. And we want you to send us as many questions as possible. You see, today I was holding my phone. Why? I did not want to not ask the question you sent me. So please, the next time you see me here with Dr. Amanda Kenya, we will be tackling the question that you're going to set to us so she can answer them next time. Until next time, God bless you. God keep you. Bye.
Bye.